Dr. Mohammed Zubair Akram, MBBS, FCPS, Medical Education. Learn, explore, grow.
Hi everyone, my name is Dr. Zubair.
And today I'm going to explain what a nuclear stress test is. A nuclear stress test is a non-invasive imaging procedure that evaluates blood flow to the heart both at rest and under stress. It is mainly used to determine whether the coronary arteries are blocked or narrowed. This test can also show if you've had a previous heart attack and how much heart muscle may have been damaged. Like other nuclear medicine procedures, a radiopharmaceutical is injected into the bloodstream. As it travels through the coronary arteries, the heart absorbs this tracer. Areas with healthy blood flow absorb more tracer, while areas with poor blood flow or damaged tissue absorb less. Modern technology allows nuclear stress tests to detect abnormalities in blood flow even before metabolic, electrical, or structural changes appear in the heart. The test is usually divided into two parts, one performed while resting and one performed under stress either through exercise or medication. A partially blocked artery might not affect oxygen delivery while the body is resting because oxygen demands are low. But during exercise, when oxygen demand increases, that same blockage can limit blood flow, reducing the amount of tracer that reaches the heart muscle. Healthy vessels dilate significantly during stress and can increase blood flow up to 4 times. However, stenotic narrowed vessels cannot dilate much more. When comparing rest images with stress images, an obstruction appears as an area with normal uptake at rest but reduced uptake during stress. Stress can be achieved in 2 ways. 1. Exercise stress, usually on a treadmill, sometimes a bicycle. 2. Pharmacologic vasodilation for patients who cannot exercise. Treadmill testing uses a protocol in which speed and incline gradually increase, raising the workload on the heart. When the patient reaches about 85% of their maximum heart rate, the tracer is injected and exercise continues for 1 additional minute. Although medication-induced stress is an option, exercise is preferred because it also gives valuable information about exercise tolerance and symptoms like chest pain, shortness of breath, or dizziness. There are various protocols. The test can be done in 1 day or split into 2. A common 1-day protocol involves injecting a low tracer dose at rest, taking SPECT images after 30 minutes allowing background activity to clear, then performing exercise and injecting a higher tracer dose once the target heart rate is reached, followed by another set of images 30 to 50 minutes later. The higher stress dose helps differentiate the stress images from any remaining radioactivity from the rest study. For even clearer distinction, a 24-hour separation can be used. In some simplified protocols, only the stress study is performed. If stress images appear completely normal, a rest study may not be needed because significant coronary artery disease becomes very unlikely.
Patient preparation is important. The patient should be fasting so that stomach activity does not interfere with imaging of the heart. Caffeine must be avoided if a vasodilator stress test is planned. Certain medications such as beta blockers, calcium channel blockers, and nitrates are often stopped at least 12 hours prior, because they may reduce the likelihood of detecting ischemia during stress. Thank you for watching. In the next video, I'll discuss the different radiopharmaceuticals, how to interpret a nuclear stress test, and when to order one.